markets. For partnership opportunities, sponsorship, or sales, email us at partnership@channelafrica.co.za. Channel Africa, the African perspective. A fresh morning, a fresh perspective. Stay tuned to Rise and Shine on Channel Africa.
The United Nations Children's Fund, UNICEF, is warning that renewed violence in parts of South Sudan is putting thousands of already vulnerable children at even greater risk. Aid agencies say that fighting is disrupting food deliveries, healthcare services, and humanitarian access. In a country where many families were already facing severe hunger and high levels of child malnutrition, UNICEF says that without urgent access and support, more children could slip into life-threatening conditions. Well, to give us an update on the situation on the ground, we're now joined by Obia Achieng, who's the acting representative for UNICEF in South Sudan. Thank you very, very much indeed for joining us, and welcome to the program, Obia.
Thank you. Thank you.
Let's start with the situation on the ground. What do you see happening, particularly in those affected areas right now? Tell us what you're seeing.
No, thank you. What you're seeing is a significant deterioration of the situation since the beginning of the year. And this is mainly in north and center part of the Jonglei state. And when we say a significant deterioration, it's estimated that about 250,000 people have been displaced. But it's not only the issue of displacement. This is a state where even before the conflict, the situation of children was grave in that the malnutrition situation was high, access to health was really limited, and access to education was also limited. So the upsurge in violence just exacerbates the already dire situation of children ground. Importantly, in terms of malnutrition, we are now estimating that about 450,000 will be at risk of severe malnutrition. And now these are children who, when they don't get access to therapeutic food, they are really at risk of losing their lives.
Yeah, I'm guessing that it's not just a deprivation of food and hunger, but there are real psychological issues that these children have to deal with.
Indeed, there are psychological issues that children have to deal with because like I said, the situation was already there before, and the psychological issues they have to deal with. It's violence against children. The children who are unaccompanied in these locations, and there are children who do not have any access to any health facilities right now, even to get those mental support. So it is a dire situation for them.
Explain to us how exactly the fighting is actually disrupting the food supply chains and health services. Is it the roads, facilities, staffing, security, or maybe even all of the above?
Well, I will say it's most of the above. It is disrupting support to children in a couple of ways. When there is conflict, which is already ongoing in Jonglei, number one is that the people providing those health services are displaced, which means that nobody to provide the care. Number two, the facilities. We are seeing about 17 health facilities that have been destroyed, and that means people will not be able to get access. Then there is an issue of access by river is limited. Access by air is limited. There basically no roads. So access by road for the limited locations which had been, that is already limited. That really constrains the degree of work that can be done in those locations, not only by UNICEF, but the wider UN agencies and other NGOs on ground. That's the real impact. Really limited access by air, limited access by road, and also limited access by river.
You've mentioned Jonglei a couple of times now. Which parts of South Sudan are currently most affected, and how large is the child population in these high-risk areas?
The parts that are most affected right now, like I indicated before, is north and center of Jonglei state. But there are also some degree of vulnerability in other locations. Like I could say specifically Duke County, we have multiple crises ongoing. Duke County, it's been reported there are some cholera cases. So that already adds to the conflict displacement. And cholera, like we all know, is a disease that spreads widely if it is not contained. So Duke County has the cholera incidences being reported in there. Then if you look at Akobo in particular, Akobo had limited access for a couple of months, but we were able to get access this week, and UNICEF was able to respond in Akobo together with other UN agencies and NGOs. Similarly, in Duke County, we're already providing some support in relation to health, nutrition, education in those locations.
What about education? That must be at risk as well.
Education is really at risk. And, this week was when schools in South Sudan opened. They opened just this week on Monday, but most of these conflict affected locations. We've not yet taken the complete census, but we know that because of the displacement, most of the children will not be able to go to school. And just to paint the gravity of the picture in here, this is a state where you find that most children were also out of school. Broadly in South Sudan, we estimate that about 2.8 million children are out of school. So when we get an upsurge of conflict, it means many more will be out of school. And without them getting access to education, they might not be able to have a secured future.
What commitments or actions do you need from the authorities and armed actors to allow aid to move safely and consistently?
Basically, two commitments or three commitments. Those locations will be able to provide support as needed. And the number two, which is actually the most important, is a cessation of hostilities. Because with cessation of hostilities, children will be able to go back to school, health services will be able to be provided, and people will be able to go back to their normal lives. So that's the most critical. The guns to remain silent, cessation of hostilities, peace to resume, and access for humanitarian actors in the locations that we do not have access. Those are the two key asks that we'll have.
And do you have a message maybe to African governments and regional bodies and even donors about what must happen in South Sudan?
We've had generous from the donors for the engagements that we've had. I know there's been we've had generous support from donors, but there've been the global impact on the support that is being provided for in South Sudan. We'll continue saying that the support is needed. We cannot give up on South Sudan, but if we give up on South Sudan, it will mean more lives will be lost. So we need to sustain the support. But more importantly, from neighboring countries and other countries is to engage with the government of South Sudan so that the peace can be restored in the country. I have to say that the engagement here, it's not only humanitarian, which is needed by all, but the political. I have to say that with the government of South Sudan also, we're engaging at various levels with the ministries that are concerned and together providing support where it can be, where we can.
Obia Achieng, we're going to have to leave it there. Thank you very much indeed for giving us that update, and let's hope that things improve on the ground for the desperate children in need there. Thanks for your time.
Many thanks for the privilege of your time as well.
That's Obia Achieng, who's South Sudan's acting representative for UNICEF, talking to us about this dire situation in the country right now.
Start